Immune disorders may be present inside your body. Do you think they are impossible to beat? Not at St. Luke's Rheumatology, Allergy, and Immunology Center. The Rheumatology, Allergy, and Immunology Center, or RHI, has a double mission to fulfill. 1. To restore deficient immune system and limit the spread of infections. These are called immunodeficiency disorders such as B-cell deficiencies, T-cell disorders, and HIV infection. 2. To correct the wayward operation of your immune system and bring it back to its normal condition. These are called autoimmune disorders such as allergies, antiphospholipid syndrome or APAS, rheumatoid arthritis, and lupus. At the center, patients are provided the best opportunity to restore their immune function close to normal. A mission made possible by its expert staff, state-of-the-art technology, and hands-on patient care.
Allergic disorders are defined by two things. One is IgE-mediated. So when we say IgE-mediated, it means there is an immediate response, and an immediate response is within 20 to 30 minutes. So for example, if a person has an allergic response or allergic problem, if it's food allergy, when he eats the food that he is allergic to, in 30 minutes, he should have a rash. And that's basically the classic definition, because an allergic disorder is called type 1. So it is characterized also by itching, having swelling or a rash, and it is basically an exaggerated response. So it's hyper. So there are many allergic disorders. People have rhinitis, itchy nose, itchy eyes, allergies in the skin, atopic dermatitis, what they call asthma of the skin, and even people who have asthma can be greatly attributed to allergy, and this is as a result of swelling and a development of a rash, and each of these symptoms may manifest differently. If it is in the skin, it is an itch and a rash. If it were in the nose, it's nasal stuffiness, swelling, runny nose, and if it were in the lungs, it would be bronchoconstriction or swelling of the airways. They develop bronchoconstriction, and the symptom would be wheezing, which is sort of the sine qua non of asthma.
So one great example would be in patients with an autoimmune condition called rheumatoid arthritis. And this is a type of arthritis where there is unrelenting inflammation, and persistent inflammation of the joints can damage the joints and cause permanent disability. So patients with untreated rheumatoid arthritis can experience persistent pains. They can have physical disability, and they can also have loss of function. So there's a great loss of time from work and productivity, and this is very much important because patients with rheumatoid arthritis are in the productive age group.
For autoimmune conditions, the RHI Center serves as a diagnostic facility as well as an infusion center where biologic therapy is provided in a safe and monitored environment. The RHI Center also specializes in managing rheumatic diseases. These diseases are characterized by inflammation and loss of function of one or more connecting or supporting structures of the body. They specially affect joints, tendons, ligaments, bones, and muscles.
So the Rheumatology, Allergy, and Immunology Center is staffed by rheumatologists who have been extensively trained to deal with patients with rheumatic diseases. Rheumatologists have been trained to evaluate, diagnose, and properly treat patients with rheumatic diseases. And in the Rheumatology, Allergy, Immunology Center, we have an extensive facility that is well equipped with a series of tests, diagnostic tests, that can properly diagnose and treat these conditions. So aside from the special blood tests which we call serologic tests, and these are tests that can help us identify and confirm the diagnosis of patients with rheumatic conditions, we also have a polarizing microscopy that can help diagnose patients with crystal-induced arthritis such as gout. And lastly, we have also added a new modality called musculoskeletal ultrasound.
Using a multidisciplinary approach, the St. Luke's Rheumatology, Allergy, and Immunology Center diagnoses, treats, and manages allergies, asthma, immunodeficiency disorders, autoimmune diseases, arthritis, and related rheumatic disorders.
So when we talk about rheumatic diseases, there are a whole number of diseases under this category. So we start off with the simple types of arthritis such as gout and pseudogout, which are types of crystal-induced arthritis. And we can also deal with other more serious conditions such as autoimmune conditions, and that would include patients with rheumatoid arthritis, ankylosing spondylitis, systemic lupus erythematosus, and patients with psoriasis and psoriatic arthritis.
If it is allergy, will cover from diseases such as in the skin. So you have atopic dermatitis, or what they call asthma of the skin. You have urticaria, which is basically hives when you have rashes all over. And some of the rashes may be attributed to an autoimmune disorder also. So some of the conditions can overlap. We also have diseases where we will be able to diagnose, and they call it cutaneous T-cell lymphoma. And their presentation is itching, a rash that doesn't resolve, and a skin problem that doesn't resolve. And it requires both holistic integration of your knowledge of allergy, autoimmune diseases, and some malignancy. Other problems is food allergy, because they want to know what their allergies are to food, so that they know they don't have to avoid it. Because sometimes it becomes a social issue wherein, for example, the parents have to always struggle in watching their child that they don't eat certain foods which they believe they are allergic to. It's important that we know exactly what they are, so that we can give them a tailored recommendation on how to avoid it effectively, and not by guesswork, because some say don't give this, don't give that, and then in the end the child can just eat a few types of foods, and the child's height and weight gets compromised. If you talk about asthma and allergic rhinitis, they may be related. You know, the symptoms of allergic rhinitis: always sneezing. Some of them develop sinusitis, headache, and also some of them develop infections as a result of the sinusitis. The patients who have asthma, we also diagnose it, because if we are able to address the asthma and pinpoint the specific allergy and eliminate the specific allergy, we will be able to effectively address asthma from the root cause of the problem, so that the use of medicines can be optimized. They don't need to use too much medicines. At the same time, they are able to feel better and get an improvement. In terms of immunologic disorders, we mentioned those with immune deficiencies. I talked about those with antibody deficiency. So the most common would be common variable. They have low antibody levels, so that what happens is they are unable to fight infection well, so they always have a pneumonia. The others is Bruton's, a gamma globulinemia. They don't produce gamma globulin at all, and they will present with recurrent infections at a very young age. And this is common in males, or this is actually found in males because this is an X-linked disease. The second significant immune deficiency would be the severe combined immune deficiency. It's severe combined because you have both cells lines that are affected, T cells and B cells, and they have problems as early as 5 months of age. They have pneumonias, they do not grow, they have recurrent oral thrushes, and they require a lot of IV antibiotics for treatment, and these people eventually will require a transplant, those with severe combined immune deficiencies, to be able to survive. So it's really a challenge in building up, preparing them for treatment. The other is what we talked about, the autoimmune disorders or the immunologic disorders, and I mentioned one where a lot of people come here is because of APAS, what we call antiphospholipid antibody syndrome, where their manifestation is recurrent pregnancy losses, and we have a lot of patients who come here for that. Other autoimmune diseases, for example, autoimmune hepatitis. In fact, we also have patients who have SLE, systemic lupus erythematosus, and their manifestation is severe thrombocytopenia, and the treatment of that sometimes is to give them immunoglobulin to reset their immune system so that their immune response would be corrected. They don't fight their own immune or their own self or their own body. Now, for us of treatment, treatment and diagnosis, if we look at allergies, so we try to identify the allergies. So we do several things. We do allergy identification, which we call an allergy skin test. The other is, if we cannot do an allergy skin test, we can do a blood test and we can identify allergy levels. Plus, we also want to see their general immunologic profile and see how high their IgE levels are. Because as I mentioned earlier, it is IgE mediated. You want to see how high their IgE levels are. For those with immunologic disorders, we look at their antibody levels. We want to see that their antibody levels are normal, because if they are normal, then they are supposed to mount an adequate immune response. If they are not normal, we will have to give them certain treatments, and I'll go into that a little bit later. The other also is we look at their autoantibodies, meaning to say there are antibodies that are what we call bad. Those are antibodies that you don't need, not the antibodies wherein it helps protect you from an infection. And we identify this because there are specific treatments. So if we go to autoantibodies and we mentioned APAS, if a person has antiphospholipid antibodies or anticardiolipin antibodies, we give them heparin because we want to prevent clotting, because it will affect their clotting, and that's why these patients end up losing the pregnancy, because they have so many clots in the placenta and there is no blood or adequate blood supply or nutrients going to the baby. Plus, we also give we'll give gamma globulin here, because gamma globulin is a treatment wherein we can reset the immune system, and it will prevent the cells that produce the bad antibodies from producing these bad antibodies. And that's what we mean by resetting it without compromising the immune system. And the IVIG is the same treatment we would give to those patients of immune deficiency. Since they lack antibodies, we are able, if we give them IVIG, we will be able to correct their IVIG level. For example, we have a child here who is about 9 or 10 years of age, used to have recurrent pneumonia. So every time she'd go into the hospital, almost every month, and she'll stay in the hospital for 3 weeks and be always on IV antibiotic because it takes a long time to clear her infection. But since when we evaluated her, we found out she had low antibody levels, and when we treated her with monthly IVIG, she hardly had to go back to the hospital for IV infusion with antibiotics, or hospitalized because of an infection. And her visits to the hospital were just limited to her monthly IVIG treatment. So she just comes here for her IVIG treatment. And now she's able to go to school, participate in school activities, she's been able to travel, and we try to make her life as normal as can be.
Some allergic, immunologic, and rheumatologic conditions are not simple to diagnose. They require complex treatment and management. This requires an expert team approach, which is offered at the RISE Center.
There are certain diseases that are hard to be defined. But nowadays, with what we have in the hospital, the facilities, we are able to diagnose most of the cases. Maybe the challenges now would be in defining the specific genetic defects, because that might be a little bit more difficult. But as far as clinical treatments is concerned, for St. Luke's, I think we have the proper equipment. We're well equipped, and the equipments that we need to make this diagnosis and to offer them treatment so that they'll have, they can live closer to normal. The second is, the challenge is not in the diagnosis, but the challenge is in identifying the people who need this type of treatment and come here, because once we see them, I feel that the facility is complete enough to make this diagnosis, and most of our patients have been happy in being able to make this diagnosis. Well, the lab procedures, we collaborate closely with the pathology, and we have special labs. We do it together with pathology. We have procedures where we're able to measure T cell subpopulation. So we look at the cells specifically, and it's done together with pathology.
Through continuous education, training, employment of experts, and clinical research, St. Luke's keeps pace with the latest developments in diagnosing, treating, and managing allergic, immunologic, and rheumatologic conditions.
So, the Rheumatology, Allergy, and Immunology Center is both a diagnostic and therapeutic center for patients with certain rheumatic conditions who are candidates to receive the so-called biologic agents. We have the ability to give these particular infusions called biologic agents in a safe and monitored environment.
Accurate diagnosis, advanced treatment, and effective management of allergic and immunology conditions. At the St. Luke's Rheumatology, Allergy, and Immunology Center, ultimately, it is expertise.